Mr. Speaker, I rise today to share with the House of Representatives powerful stories from Colorado, from real people who shared with me their experiences with health care and what we can do better to improve health care through health care reform. Renee from North Glen, Colorado, shared with me that she lived in Canada for 10 years with her husband. They had been transferred there as part of his job. Renee's experience in Canada is that the healthcare system worked extremely well, and she'd even been diagnosed and dealt with major illnesses while she was there. Renee was impressed that she had an amazing doctor that she was able to choose from a multitude of doctors of her own free will, and she had that same doctor for her entire 10 years in Canada. But when Renee and her husband moved back to Colorado, they went into business on their own. They started a small business that employed 7 staff. It's always a financial struggle to pay high premiums, but they made those personal sacrifices to keep their employees insured and do the right thing as insurers, as employers. But then the insurance company dropped them, and they picked up another, and they had to change physicians. This happens across our country every day. It happened another time, and once again, a new physician, a new history, a new relationship. In the last 10 years that they've been in the United States, she and her small company have been through about 6 different insurance programs, and unfortunately, that's all too common. If the U.S. can come up with a coherent insurance plan that lowers premiums, Renee, as a small businesswoman, writes, the economy will start picking up steam again with the extra capital that businesses will gain by lower premiums. Renee further writes that the scaremongering that's put out by the insurance lobby is mind-numbing. The horror stories of other countries' systems is sheer ignorance. Our situation in the United States is far worse, and more people die because of lack of health care. It is real experiences of real Americans like Renee that will win out at the end of the day and help convince America that we need health care reform to help people like Renee see the same doctor for 10 years, save small businesses money by creating exchanges which allow small businesses to enter larger risk pools, banning pricing discrimination based on pre-existing conditions, and tax credits to businesses for covering the employees. I call upon the House of Representatives to pass health care reform and help Renee's business and her own personal health in establishing a relationship with a doctor for a period of time. Thank you, Mr. Speaker.